My name is Daniel Kuding, and I'm an interventional radiologist at the University Hospital in Bonn, Germany. And today, I get to tell you a little about how I started my outpatient clinic. So before we talk about how I started my outpatient clinic, you really want to talk about what the motivation is behind starting an outpatient clinic. Mm, and then probably for the people, for the radiologists who already have an outpatient clinic, this is quite clear. But some of the motivations are that you really want structured care outside of the hospital that improves continuity and follow-up. And it really does facilitate personalized patient interactions and timely care. And this is true basically for any discipline. But what is the significance for interventional radiology? So what we frequently lack if we don't have outpatient clinics is direct patient engagement before and after procedures. And what this does is that it enhances patient understanding, compliance, and satisfaction. So we're essentially improving our care. So our position as radiologists in the clinical system, we want to position ourselves as key decision makers and care providers and not just proceduralists. And this really does elevate our standing within the hospital and the medical community. What are the problems we face when we don't have an outpatient clinic? Well, frequently enough, we lack structured follow-up results and inconsistent care, meaning that we can't really understand what the quality of our treatment is when we don't follow up our patients. What are our results? So basically, when we see our patients in follow-up visits, we'll be able to tell what the quality of our treatment is quite fast. And if you're a treatment and you've received, or if you're a patient and you've received treatment in an interventional radiologist, interventional radiology, and there is no outpatient clinic, it's very unclear where you're supposed to go for post-procedural treatment. What we need is a simplified access for consultations, pre-procedure evaluations, and follow-up visits. And this allows us for clear communication and management of complications in the recovery progress. So the goal, lastly, is to create a patient-centered approach to interventional radiology. What are the things we have to think about? Well, one key finding is that we need a room. So you need a physical space suitable for patient consultation. So it's not allowed to be a very small room. You need a place for examinations, even possibly minor procedures. It needs to be calm. You don't want different referrers coming in asking you questions the entire time. You need staff. You need dedicated staff for outpatient clinics. So you need to hire or maybe train existing staff. Then it needs to be familiar with interventional radiology workflows, and you need to allocate physician time. This is very important. You need to have dedicated time for clinic responsibilities. If you do not, your outpatient clinic is most likely going to fail. You need to build awareness for what you're doing. So you need to educate referring physicians about why it's important that you have your outpatient clinics and why it's probably also why it's positive for other referrers for you to have an outpatient clinic. You need to establish referral pathways to ensure a steady patient flow, maybe even increase your IR numbers if you want to. And you want to create awareness for the availability of the IR procedures that you offer at your institution. What are some of the barriers that you may have to overcome? At least we had to overcome when we started our IR clinic. You need to develop clear protocols for post-procedure care and communication. So most likely you're going to have several physicians who are going to be doing this job, and they'll most likely not all automatically have the same standards. Some take hand notes, some won't take any notes. So you need to implement electronic medical records for streamlined documentation to really have that high quality documentation that you want. You need to have high reachability, meaning if you have a phone that nobody ever answers, the point of your outpatient clinic is not really existent. So you need to have dedicated phone lines or portals for patient queries. You want to employ clinic coordinators to handle scheduling and triage. And these are not jobs that you necessarily want your physicians to take care of, but you want other staff that'll plan these consultations. What are the key lessons that we learned? The patients that see you in outpatient clinic, it's So the normal situation is that they've seen several outpatient clinics, and they'll be able to tell you quite clearly what the positive aspects and also what the negative aspects of your outpatient clinic is, and that feedback will help you to refine your workflow. You really need a well-trained and motivated team to keep outpatient clinic running and to have success in your outpatient clinic. And you want efficient resource allocation. Otherwise, your the hospital administration is going to ask you what you're doing. And if you keep all of these aspects in mind, outpatient clinic is a great way to improve your contact with patients, improve follow-up, and to improve patient care all in all in interventional radiology. So thank you for your taking part in this little webinar on how I started my outpatient clinic.